Hello, I'm happy to have with me today Kaye Pestaina, who is Vice President at KFF, where she directs its program on patient and consumer protections. Thank you so much for joining us today to help us understand what cancer patients and cancer survivors need to be thinking about as they choose the right health plans for them. So, to start, love for you to explain what are the main types of health plans offered during open enrollment, and can you talk about the differences between HMO, PPO, different types of plans like that?
Sure. Often patients will have a choice between a plan that's a HMO versus what's called a PPO. And the HMO is generally going to be a single set of providers under one roof. So if you sign up for that HMO, your choice of providers is limited just to those who are under that umbrella of coverage, whether that's a primary care or a specialist. And you typically will have to have a primary care physician in order to get to see a specialist. They are kind of the gatekeeper in the HMO. PPO is different. You have a broader set of providers. They're not all necessarily all working for the same entity. They're different practices. You'll have more variety, but they may not necessarily be coordinating with one another. Um, but all specialists, you could go to a specialist without having to get a referral from a primary care physician. So those are the basic differences between HMO and PPO. Um,
Thank you. So, how are premiums, deductibles, and out of pocket maximums structured across different plans?
well, often the cost sharing and deductibles and that all the out of pockets are structured very similar, whether it's a HMO or a PPO. Um, and it doesn't matter what plan you have. The law requires that certain preventive care treatments be free, meaning no cost sharing, regardless of the type of plan. But different plans will have different deductibles in terms of the amount of the deductible. Often, um, a type of plan called a high deductible health plan will have low premiums, but very high deductible payments. And the deductible is really the amount you have to pay before your health insurance kicks in. And if it's really high, if up and it's only getting higher these days in the thousands of dollars, you're going to have to pay that in addition to your monthly premium before you can access care at what other cost sharing there is. So HMOs and PPOs can both have deductibles. So you're going to want to compare the amount there versus the amount of premium. Um, Particularly for cancer survivors, you're going to be using care, um, and particularly for those who have to get, um, for example, certain labs or screenings, MRIs, for example, over time. Those are high, costs a lot of money, and you may have to pay that out of pocket depending on the time of year you're getting that. So deductibles and cost sharing are important factors to weigh in, and they are unfortunately features of all coverage: HMO, PPO, high deductible plans.
Can you talk about the preventive screenings that are available at no cost, and what are the exceptions to that when you might actually be charged for something and that you may have thought should be at no cost?
Well, there's screenings, and the rules around what actually is a preventive care screening that is zero cost sharing. It's not always intuitive, and so patients should do a little bit of research in this area. The typical ones that are easy to are the preventive care mammograms, for example, and other cancer related screenings. But for those who already have a diagnosis, the zero cost sharing may or may not apply, and they're going to kind of have to uh, pay attention to the rules there. Some medications, for example, may be zero cost sharing because they're deemed to be preventive, like tamoxifen for breast cancer, or should be zero cost sharing in most instances. But there's always nuance, and the cancer patient should be aware of what is zero cost sharing and what isn't. It's like I said, it's not always intuitive, but you should always be asking. If you are asked to pay a copay for those kinds of screenings, you should always check to make sure that's accurate. Um,
Now, I would like to ask you about provider networks. So, can you talk about the role of provider networks in choosing a plan, and one concern for cancer patients and cancer survivors is they often need to see specialists who are not always in network. And I think this can be a problem both for employer sponsored plans, but also health insurance marketplace plans. And I know you and your colleagues at KFF did a study on the ACA marketplace plans and found that there was really a wide variability in the specialists that are considered in network. So could you talk a little bit about that, and then what can you do if the providers you need are not in network?
Yeah, our research has shown, as you said, that there's just such a wide variation in the kind of the breadth and depth of networks across different types of coverage, whether it's HMO or PPO, and in particularly in marketplace, um, that are narrower than your typical employer coverage. Not a surprise, but I think for for cancer patients who are going to see a variety of specialists, as well as seeing their primary care physician frequently during the year, this is an issue. This is an issue, and it's not necessarily unique to marketplaces. I think everyone, regardless of your coverage, you got to do your homework on making sure your care team is in network. Otherwise, you're going to be paying more, or you may not even be able to access those specialists, depending on the plan you choose. Um, so for your cancer patient, the law requires that all plans have up to date provider directories. But that's not what we've seen that those directories are not always up to date. And it changed folks' providers' participation in any particular network changes from year to year. So at this point, what time of year where there's open enrollment, I think sometimes people assume their provider that they saw in network last year was going to be in network this year, or that the broad networks they saw when they enrolled several years ago have changed. Unfortunately, we have a healthcare system that's going through rapid change and consolidation, and we just have demographics, lots of providers who are retiring, baby boomers who are retiring. So things are changing. Patients really do have to do their homework, even if they're staying in the same coverage. So this is the time of year where, say, you're happy with your plan in terms of your access to specialists. You still do have to check to make sure your care team is still in network before continuing enrollment in that same plan. And of course, you may find broader networks broader. You may find that by just looking at other plans. You may be surprised that I think sometimes people assume that they have broader access in a PPO than an HMO. What some of our research shows is that that's not always the case. So you got to do your research and find out the practitioners whose care you need and whether they're in the network, and that you have your kind of your primary care provider is an important gatekeeper for cancer patients, and so that you're comfortable with that primary care provider, and if you're not, you have access and the ability to choose another if that's best for you. And that's often what we found in our research is that's one of the key practitioners who are hard to find, and the networks are narrow for those types of providers. Um, so you want to make sure you can continue access with your primary care. I think although specialists are key for a cancer patient, don't forget that primary care person really is helping you to navigate across providers, even if you don't need a referral, because they know they should be aware of all of your care, and that's going to help you the best as kind of the
Mhm.
navigator of your care team.
Thank you. So, I want to ask you about prior authorization, which often can be a challenge for cancer patients and can cause delays in getting treatment. Is there any way to know when you're choosing a plan how that plan will handle prior authorization and what types of things will need prior authorization, or is that not something you can really determine when you're choosing a plan?
I'll say that it's difficult. All plans are required to include information about their practices with respect those kinds of services that require prior authorization. But it's not always easy to find. A lot of it is very high level. For a cancer patient, there are very specific types of services or drugs that you're not going to find listed in your plan document necessarily. There's no way any document can cover every treatment that's prior auth or in a couple of pages. You're going to really have to dig in and ask sometimes by going to customer service or talking to the carrier. It is There are efforts to make that information more accessible and available for certain kinds of coverage, like Medicare Advantage plans and marketplace plans. For employer coverage, there aren't any new protections, so you really will have to spend a little time to figure out what those processes are. I think um, it's a problem for patients who really do have to also rely on their provider to help them navigate that prior
Hmm.
authorization system.
Yeah.
um, there's a lot of focus on prior authorization for these very reasons, that it's not always clear to the patient what treatments will require prior authorization or what the process is, and
Hmm.
there's kind of efforts underway to help you. But at open enrollment, for those, at least for those treatments you will need and medications, you want to, if and you're thinking about changing coverage, the problem that folks often come up with is that in the new plan they have to get that they had the treatment with will now require a new prior authorization for, say, medication.
Hmm.
That is a big hurdle for many patients. That in taking a drug which they received prior auth in an old plan, they change to a new plan, and you have to go through the process over again. You just have to be, unfortunately, you just have to be vigilant about what those steps are, and to get as much information from the plan up front, so that in January you're not scrambling to continue the medication that you have been receiving or the service that you have receiving. Unfortunately, we don't know. Every plan has different rules for what services and medications they prior auth, and that is really the a big barrier for patients.
Yeah. I have definitely experienced that where changing health plans and then the medicine that my son was on for a long period of time now had to go through prior authorization because it was a new plan. So that's very challenging. It just adds a lot of burden to the provider too to make that happen, and then delays in getting the medication.
Yeah, we certainly hear that, particularly with chemotherapy drugs, for example, that require prior auth, and really time is of the essence for people
Hmm.
to get those medications. So know as much as you can about those processes for the plan that you select.
This is a lot of burden on the patient to do a lot of research and try to figure this out. What are the resources available to help them when they're trying to compare plans? Are there online tools, or can they go to their employer's HR department for help, or do they just have to do the work on their own?
It's tough. There's not that many easy resources available for folks. Obviously, for marketplace plans, there are navigator organizations in some states that are funded by the federal government that can help and provide one-on-one sometimes support for folks as they choose amongst the marketplace options they have, and that's an important resource. um, for those in employer plans, they don't really have those. Obviously, there is their human resource or benefit manager, depending on how large the company is. They may have actual benefit manager that has some information and is able to help, but that's not the case in most circumstances. HR professionals have a lot to do within organizations. They're doing hiring and other things, um, and they may not know that much about the workings of the benefit programs for which they sponsor. I've certainly
Hmm.
seen that, having spent some time in the employer space. But some employers are actually, some of the larger ones are engaging with what are navigator services. In other words, they contract with entities that specifically are there to help the employees navigate health care treatment, kind of a clinical options. So those might be helpful. But when it comes to um, actually choosing insurance coverage, um, um, outside of the HR professional, I would just tell patients there may be some community consumer organizations in their area that might be able to sit down and help them. I think part of the Affordable Care Act was the funding of what are called consumer assistance programs that were initially funded when the ACA was passed, and some still exist in some states that are there not just for marketplace plan enrollees, but also for employees and anyone with coverage to help navigate. And some of those folks still exist. We call them the CAP programs. Um, um, but fewer and fewer. They're no longer. There has not been any recent funding at the federal level for them. But um, I would ask folks just to use whatever local community resources, even your care team, your clinical care team, your in your oncologist's office may have referrals to places, support programs that might be able to help you navigate the insurance world. Because obviously all those patients are kind of doing the same thing at open enrollment time and figuring out what are the best insurance options that are accessible geographically and are good quality care for patients. So as with anyone, we're going to ask around. And of
Mhm.
course, a good place to start, as I said, is your clinician's office and their staff, and what do they know? Are there support groups and other organizations locally that folks can meet and see other people's experiences with different types of coverage.
So, if you have a plan that you're happy with, how do you ensure that there aren't changes to the plan in the next year that would affect your coverage? I know that plans are required to explain any changes in their plans, but how do you analyze that to understand really how it might affect you?
Well, some very large employers will, at open enrollment, actually highlight this is what's different about from this plan this year. That's a good thing. Most people don't have that though, because they don't necessarily work for the very, very large employers. But the document that's kind of the first place to look, it's called the Summary of Benefit and Coverage Requirements. It's designed to be kind of a snapshot of certain features of that coverage, deductible, key things that are excluded from coverage, that type of thing. So even if you're keeping your same coverage, you want to look at that, we call it the SBC document, um, to see if there've been changes. Key places are obviously you're going to look at the number, the deductible amount, and other things, but also you want to look at exclusions. Are there things that some big exclusions that might affect you? There might be a change even in costs for things like emergency care, right? We're raising the fee for use of emergency room to $100 fee to a $200 fee or something. Those kinds of things that might change from year to year. Um, that's not going to give you information about your provider. You'll want to look at a provider directory, the link on that carrier's website to the most recent provider directory to just do a check that your providers are there. Um, but the first thing to look at is that SBC, and you also may want to look if there are particular types of treatments that are at your know you will need. Um, you might want to look at the broader, we call it the plan document, which is that very long document that gets a little into more detail about what's covered, um, and to look at that document along with the plan's formulary. Sometimes, your medication may still be covered, but maybe it's moved to a different tier. Tiers, formularies have usually 3 or 4 different tiers that translate to how much you're going to pay. Particularly if you've taken a specialty medication, that are the highest cost drugs. Is your drug still covered, but is it still covered in the same tier? What's the amount for the same medication that I have been taking? What will that be next year? So that sounds like a lot, and it is a lot. It just goes to show you that there's Just a lot of information to navigate, but it's important. It's worth the time to kind of sit down with that information, even if you're continuing with the same coverage you had last year.
Thank you. So you've given us a lot of great information. So I just wanted kind of overall summary. What is your advice for a cancer survivor who wants to choose the best plan to meet their needs for both treatment and post-treatment care?
The first priority is making sure you have your care team available to you in network, and that team is your primary care, your oncologist, and whomever else you're seeking treatment. Um, are they available to you? Are they still in the network? And that's the first. And then of course the second is, are there going to be changes to my out of pocket costs? And is that, if those numbers are going up in terms of cost, what are my options? Um, should I change my plan? Will I still have my providers and other options that are cheaper? That type of thing. Um, but the key advice is just to stay vigilant and seek help. And there are, I think sometimes we tend to do all of this stuff alone when there may be resources that are close by, to help and reach beyond the typical places you would go. If not, if you don't have an HR person that is knowledgeable of this, what kind of local resources in your community, from consumer assistance programs to navigators. Don't go alone. Go it alone, because it's too big a task sometimes to do that. And we have other things to do in life.
Mm-hmm.
Go ask for help. There are increasing resources, although there's still great need for more information and education in this area. There are some people available to help. So ask the question to even your physician or other care providers. They may have some resources to refer you to.
Thank you very much. Really appreciate your sharing your expertise and wisdom with us. And I know this will be very helpful to cancer survivors.
Thanks for having me.